Lance with HealthySimulation.com. I'm standing next to Beth. We're at the SimEMR booth, which is a division of Pocket Nurse. We're at IMSH 2014. And I wanted to learn a little bit more about SimEMR because Pocket Nurse acquired it recently, about a year or so ago. And I know that they've been really kind of undergoing a new marketing and launch campaign to the domestic healthcare simulation users and educators around the space. So tell me a little bit about SimEMR.
SimEMR, it's a wonderful tool. It's an entry-level simulated electronic medical record. What happens so commonly, and my customers completely back this, students don't often get the opportunity to document in the clinical setting for many reasons, privacy reasons, HIPAA, so they're left learning on the job later on in their career.
Right.
There's patient safety issues associated with that, and there's an insecurity by the students. So SimEMR is a bridge to give students that opportunity to feel comfortable and confident with an electronic medical record before they enter the workforce.
And so it also allows for the clinical educator to program specific scenarios, I'm thinking, or patient cases, so then it provides the opportunity for the learner to go in and really engage with entering that patient data, looking up patient data. Are there quizzes also associated with what's going on with SimEMR in terms of like once something is done that a quiz takes place, or how does the learning process actually happen?
So the students are able to document in any section that they're asked to document, and it's a wide open, full-bodied, simulated electronic medical record. The instructors have the opportunity to evaluate or shadow their students' work, so that's how they're evaluating performance. We hope in the future with some enhancements to make it communicative so that the instructors can actually give feedback in SimEMR.
And so how does the fee structure break down? Is it per student, per license fee, or is it per institution? How does it break down?
So it's based on an annual subscription. It's a tier pricing model. So like anything else in life, the more you purchase, the lower the price. So it's by user per year subscription, and it's by volume. So most institutions right now are buying for their students, and the reimbursement is behind the scenes. We don't see that. So for example, the first tier would be 1 to 49 users. That would be the highest tier of $99 per user per year.
Okay.
Then it goes lower from there.
Okay, great. So can we also incorporate this in their high-fidelity simulations in the lab, maybe for part of the patient entering the data or looking up that data? Can we use this to incorporate that kind of aspect?
Absolutely, and that's exactly where we're heading. The awareness of that application of SimEMR is really what needs to get out there. Right now, most folks are still using paper and pen, or they're not able to use the provider that provides their EMR in the hospital setting to get a training module for the sim lab. So SimEMR can be that supplemental bridge, if you will, to be right in the sim lab. Students can document their patient experiences right in real time in the sim lab. Anywhere there's an internet connection, SimEMR can be used.
Okay, great. Could you spend a few moments walking us through the screen and showing us a few things?
Absolutely.
Great.
Sure can. So let me share how a new patient would be entered into SimEMR. It's very easy. Each time you come into SimEMR, or log in, I should say, you have your user login access and your own individualized password. So that's how I got here so far. To create a new patient, you simply go to New Template, and that opens up a blank slate for your entire EMR. But we'll look at an existing patient so I can give you an example of what chart tabs are documented on for this particular patient. So I'm selecting an actual patient that's already placed in SimEMR. We're going to view that patient. It's going to open up the patient's entire electronic medical record. And you can see on the right are the different chart tabs that represent what you would see in a real hospital, or if you will, in the past patient charts that were hard copy. So from admission to discharge and everything in between, there's an opportunity for documentation. Let me show you nurses' notes, for example. So in nurses' notes, there's an opportunity for medication reconciliation here at the top. That process frequently gets missed by students. It's usually done by the admitting nurse or admission member. So here's an opportunity for medication reconciliation to be done at the top of my screen, along with, if you can follow the sub-tabs, there's many different types of nurses' notes that exist. SOAP notes, charting by exception, and narrative notes. So whatever type of documentation students are most comfortable with or use in their facilities, it's all in here. Charting by exception gives a great opportunity for learning system norms along with documentation practice. Here's all the system norms for the main body systems. And there are many more if you just scroll down. We have a Braden score. We have a pain scale. We have a fall risk assessment. They all auto-calculate the total once numbers are embedded.
Okay.
And just simply by hitting save and update, this information gets saved, and instructors can go back at any time under the shadow student feature and shadow their students' work and provide feedback.